Is breast sagging a concern for you and you would like to know something about breast lift surgery? Please continue to watch this video because I'm going to give you a lot of information about breast sagging and breast lift surgery, also called mastopexy. My name is Dr. Amit. I'm a plastic surgeon. We have an extensive experience of 11 years in breast cosmetic surgery, and we are located in Delhi and we are operating out of Gurgaon and Mumbai as well. So first thing, what is breast sagging? So let's discuss as a patient, how do you define breast sagging? I'm not going to use any medical terms. I must request you to please watch this video till the end, because it's only at the end you will really come to sort of summarize everything about breast lift. I'm going to really clarify the situation for you. And please subscribe to my channel because that will tell you all about my interesting videos. My next video is on breast reduction, then on no surgery as well. So as a patient, what is breast sagging? If the nipple comes down from a normal level, what is a normal level? The normal level is the line which is drawn forward starting from where the breast touches the chest. So for example, if I turn on my side and the breast is like this, it touches here, I draw a line straight. If the nipple is below that line, it is defined as breast sagging. So I'm sure that is very, very clear. Now it has different grades: mild, moderate, severe, or grade 1, 2 and 3. So mild sagging is when the nipple is only about 1 to 2 centimeters below. 2 to 3 centimeters is 2, and more than that is severe sagging. So why does sagging occur? Most common reason is pregnancy. So post pregnancy, after breastfeed, once the breast volume comes down, most women will note that the breast has sagged down a little bit. Second is weight loss. So extreme weight loss is in bodybuilders, in people who have undergone weight loss surgery. That's the second one. And third, there are some women who already have that as they go through the pubertal growth. So this tells us, so the first 2 points I tried to cover is what is sagging and what is the causes of breast sagging. Now, why is breast sagging a concern? So here there's a bit of a cultural difference between, say, the Indian patients and say a Caucasian, Australian, American or a European patient. Now a lot of patients need to get onto the beach in the Western countries, in areas where there is a coastline. So for them, the cleavage, the breast shape is extremely important because they wear bikinis. And for that, if there's sagging, they don't get that full effect which they want to create. So for them, it's a little embarrassing to not have a good breast shape and a nice breast contour. In other patients, like more towards India, if we see, breast sagging causes a concern because the bra has to lift up the breast, or the blouse has to lift up the breast, and for them it causes problems in stretch marks of the bra straps, or the breast bra size is not really exact. Sometimes women just don't feel comfortable with their partner, so they feel inadequate or they feel inferior if they have breast sagging, and sometimes their partner also tells them that you don't have the perfect breast. So that is one very, very important concern which a lot of patients actually tell us. I mean, at least about 91 to 92% patients actually tell us that the third reason where they don't feel comfortable with their partner is actually a very important cause. So what are the treatment options? Now there is no medicine for breast sagging. So please understand, do not waste your time and energy on medicines for breast sagging. There is no massage, there is no oil for breast sagging, there is no exercise for breast sagging. So the only option is surgery. A lot of times patients come to us that they have been told by doctors that breast implant is the answer for breast sagging. Yes and no. Please understand, yes and no. Now breast implant to lift up the breast is great for mild sagging and moderate sagging. But in a severe sagging, understand a breast implant works the other way. So I'm going to show you again how you're going to easily understand this. Now I'm going to turn on my side again. Now assume that the breast has fallen down. So it's come down like this. We place the implant here. The breast is here. So this is called a double bubble, a B appearance. So in severe sagging, God forbid, please do not do a breast implant. And if the doctor tells you to please ask their doctor to revisit their education. Mild, grade 1, grade 2, sometimes in grade 2 you can get away with a breast implant, but that's not ideal. But in mild, yes, breast implants work very well. Now I'll actually come down to the algorithm or the treatment chart that you can make. So if a patient has adequate volume of the breast and only has sagging, she should do what is known as a 𝗕𝗿𝗽𝗻𝗀𝗻 procedure, a lift procedure. I'll tell you about that as well. So you need to watch that till the end. Again, a request to subscribe to this channel if I'm adding to some knowledge. So if a patient has good volume, 𝗕𝗿𝗻𝗀𝗻, if a patient has poor volume, then she will need something called augmentation 𝗕𝗿𝗻𝗀𝗀, which is a breast implant plus 𝗕𝗿𝗻𝗀𝗀 procedure. I've already said in what situation you can do breast implant and what you cannot. So how is a breast lift done? So we make a lollipop type scar. So around the areola, so we can make the areola nipple size also short. Do that, and a vertical scar which is like the stick of a lollipop. It's not very thick, it's a fine line from the nipple down, and through that we lift up the breast and place it on top. The projection and the lift that is achieved is such that you don't even need to wear a bra to support the breast. The results will easily stay for 8 to 10 years. Now if someone wants more enlargement, so we can do fat injection from the abdomen, we can inject fat, or we can put in an implant to increase the breast volume as well. On an average, a surgery takes anything from 2 to 3 hours, done in the hospital, same day discharge, 2 to 3 days of rest, no exercising for about 3 weeks, and back to work is as soon as the 3rd day. An average cost for such a procedure could be somewhere between 1.25 to 2 lakhs depending on what all we are planning to do. And in terms of safety, it is an absolutely safe procedure. It's a very comfortable post-operative recovery. Most patients are surprised by the relative lack of pain in this surgery. So in this topic, in this video, I've tried to cover what are the causes, how does it manifest, symptomatology, why do you need treatment, and what are the treatment options, and post-operative the precautions that you need to do with breast lift surgeries. I'm sure this video has been of value to you. If it has been, please subscribe to this channel. You can call us on 9811994414. My center, Divine Cosmetic Surgery, is located in Delhi and Gurgaon, and you can get in touch with us on email as well, info@divinecosmeticsurgery.com. You can call us again, 9811994414. Please subscribe to this channel and please watch my next video, which is going to be on breast reduction. My name is Dr. Amit, I'm a plastic surgeon, and have a wonderful day.